we talk about the problems with diagnosing Lyme disease. It's because it's the great imitator. And by that they mean it could present with so many different symptoms. The symptoms, for example, can mimic lupus or arthritis or multiple sclerosis or fibromyalgia or dementia, Lou Gehrig's disease, attention deficit disorder, depression, anxiety, chronic fatigue, Parkinson's, Alzheimer's, and even autism. So how many patients with those diagnoses have been tested for Lyme? And then the second problem crops up. You get the test for Lyme and it's negative, but then you have to understand the test is not a very reliable one. In animal studies, and this is important to understand too, they show that in less than a week after exposure to the Lyme bacteria, it can be found embedded inside tendons, muscles, tissues, the heart, and the brain. So, so fairly quickly, it's beginning to create various types of symptoms. So that's why you can have your arthritis types of pain, muscle pain, cardiac issues like arrhythmias, for example. And we mentioned also some of the problems with brain function, like attention deficit disorder or depression or memory issues. And here may be the reason, Janet, why it's so important if you're going to try to treat Lyme disease that you have to do it quickly. In other words, well, here's the first step. If you see the tick, I think you have between 24 and 36 hours max to remove the tick, because after that time, it's had enough time for the bacteria to enter your body. And then you want to treat it with the appropriate antibiotics. But if you don't, if you miss that window of opportunity, the bacteria then protects itself with a biofilm, and that's probably why the antibiotics don't work. And that's also probably why the lab tests don't detect it, and the body's own immune system doesn't go after it as well. We've been talking about Lyme disease, and then the topic of biofilms came up, and that may be one of the reasons why after a certain period of time the antibiotics aren't effective against Lyme disease. But biofilms can actually protect bacteria from antibiotics in a large percentage of cases. It's basically substances the bacteria secrete that surrounded and protected from these treatments, so that antibiotics don't reach it. Now, interesting approach here is some of the oxidative therapies that we've talked about that may that are proving to be effective in breaching these bacteria that are protected by biofilms. Just something to keep in mind. So, the one that we prefer is one of the latest treatments is the polychromatic intravenous light therapy. It's the exposure of your blood, but you don't have to take the blood out of the body, to the ultraviolet light along with red light and green light, which work to strengthen your immune system, improve the circulation of blood throughout the body, and very effective in treating all types of illnesses, particularly Lyme disease. And down in Florida, like I said, we don't have the high incidence of Lyme disease that they have in the Northeast, but there are doctors in the Northeast that have several polychromatic intravenous light therapy devices treating people, because it's such a prevalent condition there. But I do want to get back to to the biofilms, because that's really a significant problem in treating many illnesses, and it may be the reason why there are so many failures with antibiotic therapy, because if they're trying to breach a bacteria that has formed a biofilm, it's not going to be effective. So that's where these other approaches come in, like the ultraviolet therapy or the polychromatic intravenous light therapy. So we were talking about the issue of Lyme disease in Florida, and just how difficult it is to detect. And here's the important point, and the point I'm trying to make here is, your doctor may not be thinking Lyme, so you may have to remind him that you may have a symptom that may have been triggered by exposure to Lyme disease. So again, those symptoms could be something as common as a headache, fatigue, fever, joint muscle pains. Maybe if you saw the rash, maybe you didn't. And that's the early stage symptoms. Later stage infections can affect the central nervous system, and then you start having symptoms associated with the brain or the heart or your musculoskeletal system. Now, so what happens is there's probably a latent period there where you might not have any symptoms after the initial exposure to Lyme, and then all of a sudden you turn up with fatigue or congestive heart failure or even multiple sclerosis. And I'm pretty sure that every patient with those symptoms is not being checked for Lyme, because we really don't know the extent of the illness. And that's part of the reason, people are, you can't diagnose something if you don't look for it.
Dr. Slavin, what about the patient who comes to see their doctor because they've been having arrhythmias? What might typically be suggested to someone whose symptom is arrhythmia, that they feel well, they're doing okay, they don't have any other symptoms, they just have an irregular heartbeat, a pounding heartbeat, a racing heart? What typically might a doctor do for that?
Well, typically they put them on a drug to suppress the arrhythmia.
They put them on a drug focused on that symptom alone. So the underlying issue, what precipitated the beginning of this situation? It is disregarded.
Yes, it is, because it takes too much time and effort to talk to the patient to figure out why the patient is sick. Because if you spend the time and ask enough questions, the patient will usually tell you what happened. So what is the first thing you have to do is, maybe inquire about the possibility of exposure to Lyme. But I have to tell you that we have to think more about Lyme, and even in Florida, because it's here. And here's the interesting thing. Patients with chronic Lyme disease, in other words, you miss the initial exposure, and the patient developed the symptoms I previously mentioned, and on average it takes about 1.2 years before being correctly diagnosed. So in other words, patients are being treated usually symptomatically for all that time, and then luckily perhaps they might get someone to check for Lyme disease. But in many cases, some patients are suffering with debilitating symptoms for 10 or more years before receiving a proper diagnosis. At the highest risk of acquiring Lyme disease are children. So when you study children with Lyme disease, they've noted that on average, 4 doctors were seen before a proper diagnosis was made. Why do you see more than one doctor? Because first doctor didn't help you, the second doctor didn't help you. They treated you. You go to 10 doctors, you can get 10 different treatments. But if you don't find the underlying cause of the problem, you're going to not be successful with the treatment. Now this, brings me back. If you listen regularly, you may have heard me mention this about Chris Christopherson, who was diagnosed with one of the illnesses confused with Lyme disease. He was diagnosed with Alzheimer's disease. And about 6 years after that initial diagnosis, one of the doctors he was seeing said, we should check you for Lyme disease. And he tested positive, and when they started treating him for Lyme, his symptoms that were previously diagnosed as Alzheimer's began to improve. And we've been talking about Lyme disease. And, the group that's probably affected the most are children. They're running out in the fields. They could pick up a tick bite, and you might not know it. And then they turn up with attention deficit disorder or other symptoms normally seen. And it takes time for the diagnosis to be treated. They say as many as half of the cases of Lyme disease report having no known tick bite or the classic bullseye rash. So you talked about how do you make the diagnosis. Well, it's kind of difficult sometimes. In one report, more than 50% of patients develop serious brain or central nervous system involvement, many requiring hospitalization. So that may be the first presentation, and you may not put it together with Lyme. And then over 40% of Lyme patients have reported arthritic symptoms, such as a painful joint swelling. So what happens when you go to the doctor with joint swelling? They'll treat you for arthritis. They'll give you maybe an anti-inflammatory or maybe an injection, or if it persists, they're using some drugs that used to be used for, under the category of chemotherapy to treat the joint swelling. But have they tested you for the possible causes of that? And now, as we mentioned earlier, there are some researchers that are indicating that Lyme can be sexually transmitted, and also it's been detected in breast milk, in umbilical cords, the uterus. In other words, it could be passed from a mother to an unborn child. It's seen in urine, blood, the brain, and other bodily fluids. So, if one person in the family got infected by the tick, they have the potential to spread it to the rest of the family. So you mentioned, all right, so what do you have to think about first to start thinking that Lyme might be the problem? Well, again, if you think you may have potentially been exposed to a tick bite, so that's the first thing, in association with headache, chills, fever, fatigue, swollen glands, aches and pains, and these are such common symptoms, that we don't automatically think about Lyme disease as being a potential problem. So then you want to go for testing. But according to Johns Hopkins, Lyme tests miss 75% of the people who are infected with Lyme disease. And some medical literature indicates up to 90% of patients are missed using current testing procedures. So that's why they say if you suspect Lyme, forget the test, treat the patient. See, I think that's part of the problem too, Janet. Doctors are so used to just believing the results of a test instead of using their mind to think about why the patient is sick and doing, an appropriate treatment. And again, that's why, we do that, ultraviolet blood therapies and intravenous polychromatic light therapy, because extremely effective and better than antibiotics because it has no side effects. So that's why, I brought that technology into the office, because so many patients present, and I'm sure you've seen this too, they have a long list of symptoms, like we mentioned, very common, like headaches, fatigue. Sometimes they complain of night sweats, aches and pains. Some of the people might experience the cardiovascular problems, or the maybe they're saying they have brain fog or memory issues. And you wouldn't automatically new onset. If you're thinking Lyme disease, you might want to try a course of antibiotics. But the benefit of the polychromatic intravenous light therapy is that it doesn't just treat Lyme disease. It treats all different types of infections in the body: viral, bacterial, fungal, and even parasites. So it's really a good result. And I said I brought that in because, Janet, many patients present with these vague symptoms. They've been to lots of doctors. They can't find out why the patient is sick. Even if the doctor thought of Lyme disease, we just mentioned how inaccurate that test is. So they're just
Dr.
receiving...
Slavin,
Yes.
so it would not necessarily give a clue if the patient's white blood cell profile was not in the normal ranges?
Even if the white count was elevated, it wouldn't tell you what's causing it. Even if your inflammatory markers were elevated, it wouldn't tell you what's causing it. You say, well, you have your aches and pains, your arthritis. You've got inflammation. That's causing the inflammatory markers to go higher, but it doesn't tell you what's causing that inflammation. Now we've documented over and over again patients that we've treated with elevated inflammatory markers. We've been able to reduce them with the intravenous light therapy. So it's a very effective treatment for a whole lot of different problems. We harbor so many different infectious agents in our body. We mentioned a week or so ago that it's been documented that the human body can there are potentially over 200 different infectious agents that have been found to affect humans. Not all at once, obviously, but different agents. So when you use a treatment like the intravenous light therapies, you're not going after the bacteria individually. You're just going after foreign bacteria or foreign infectious agents in the body, but you're also strengthening the immune system and improving blood flow. Now, Jenna, here's an interesting fact. There have been over 300 strains of Lyme disease that have been identified.
Wow.
And this may be why the tests are not that good, because the standard tests only detect exposure to one of the strains of Lyme disease. And in Florida, they say there are at least 8 different strains of Lyme disease that have been documented. And now to add insult to injury, besides Lyme disease, Florida is also home to over 60 additional tick and vector-borne diseases. And by vector, we mean diseases transmitted by other insects or animals. So there are 20 strains of Babesia, which is another tick-borne disease, and you can't detect that with standard blood tests. So there are 2 strains currently known to infect patients in growing numbers. That's the Babesia microti and the Babesia duncani WA1. You can get tests for both of them, but where do how do you know what to test for when you have over 200 potential infectious agents that could be creating the symptoms? And I want to just remind everybody, because one of the most serious problems affecting people as they get older is Alzheimer's disease. And Alzheimer's disease, I think, as a cause of death, is now listed number 4 on the causes of death. And they're beginning to associate Alzheimer's disease with perhaps an infectious component.
Dementia, there may very well be an infectious component. And you were talking that it's in all of the states here in the United States, and it's in countries around the world. So, even though we have come to name it Lyme disease based on it having been found in Lyme, Connecticut, but it's all over the globe, and the potential for becoming infected with what we characterize as Lyme disease and ultimately having dementia is a potentially very common issue.
Extremely common. Now, they say, interestingly enough, it's more common in Western Europe, with North America being close behind. And it's least common in sub-Saharan Africa. Now, that may be just a reflection of life expectancy. The countries where you have the longest life expectancy, you would see more cases of Alzheimer's dementia. Because if it is indeed an infectious disease causing it, like neurosyphilis or neuro-Lyme, it takes 20 years or so before it reaches the point of causing that problem. But you have to think about it, and I think if you use the same rationale that they apply to telling people to get vaccinated against this virus or that virus, I would use the same thinking when it comes to being treated with the intravenous light therapies that are very effective against all these different infectious agents, to protect yourself without the side effects. And you mentioned all the added ingredients that they put in vaccines, like aluminum, mercury, formaldehyde. Some of them even have components of peanuts in there, and they speculate that's why we're seeing a rise in peanut allergies.
Those additional ingredients would be to have a more dramatic stimulation of an immune response. But you have that dramatic immune response, but you also have potential for significant damage throughout the body. And that you can't get rid of some of these substances, for instance, like the mercury and the aluminum. They accumulate in your body. So if you're dealing with multiple vaccines, that accumulation is pretty significant.
I think we're just underestimating the possibility of infectious disease causing problems. Because the medical establishment is happy with the status quo, where they're selling lots of drugs to treat the symptoms and not really making a dent in the deaths from these causes. Heart disease is still number one cause of death. Cancer, number two. Number three could be stroke. You could also put in there deaths from the appropriate use of legal prescriptive drugs. But number four, you come in with Alzheimer's. Lots of drugs being prescribed for all these conditions, but they seem to be missing the underlying cause of the problem. That might really make a difference.